Hello there, and welcome. Today, we're going to talk about something that's often misunderstood: female sexual dysfunction. It's a big phrase, but all it really means is this: a woman has ongoing problems with desire, arousal, orgasm, or pain that keep her from enjoying sex. Now you might be wondering, is that even real? Or is it just a made-up label? Well, that's a great question. And you're not alone in asking it. In this video, we'll explore what female sexual dysfunction really is, what causes it, both physical and emotional, why it's not the same as what men experience, and most importantly, what can be done about it. Let's take a gentle, honest look at a topic that deserves more compassion and less shame. So what is female sexual dysfunction? Let's start at the beginning. When we hear the word dysfunction, we think something is broken, but in reality, female sexuality doesn't have a single clear definition of what normal even looks like. For men, it's a little simpler. An erection is visible, measurable. For women, sexual response is more complex. It's about emotions, hormones, physical feelings, and the relationship all working together. So when doctors talk about female sexual dysfunction, or FSD, they usually mean one or more of these four challenges. Low desire, also called low libido or hypoactive sexual desire, means a woman has little or no interest in sexual activity, even when opportunities are present, and even if she used to enjoy sex before. This can look like rarely or never thinking about sex, not initiating intimacy with a partner, feeling indifferent when a partner shows interest, sometimes even feeling distressed about the lack of interest. Trouble with arousal means a woman's body does not respond the way it normally would when she feels sexual desire. In simple terms, even if a woman wants intimacy, her body might not become physically ready. This can look like difficulty with vaginal lubrication, dryness, less blood flow to the genital area, or reduced sensitivity. Emotionally, she may feel disconnected or frustrated because her mind says yes, but her body doesn't follow. Difficulty reaching orgasm. Even with enough stimulation and desire, a woman may find it hard, delayed, or sometimes impossible to reach orgasm, the peak of sexual pleasure. This can feel like a long buildup without release, reduced intensity of orgasm, or no orgasm at all despite wanting and trying. Pain during sex. Medical term dyspareunia means a woman feels discomfort or pain in the genital area before, during, or after sexual intercourse. This pain can be at the entrance of the vagina, burning, stinging, tightness, deep inside, aching or cramping, during movement or even lasting afterward. Common causes include vaginal dryness, common after menopause due to low estrogen, infections, urinary tract infections, yeast infections, pelvic conditions, endometriosis, fibroids, pelvic inflammatory disease, past injuries or surgeries. Emotional factors, stress, fear, past trauma. In simple words, pain during sex is when intimacy causes physical discomfort instead of pleasure, often linked to body changes, health conditions, or emotional reasons. And here's the key: none of this means a woman is broken. Often these changes happen for a reason, sometimes physical, sometimes emotional. Therefore, we can confidently say that sexual health is not just about intimacy, it's about overall well-being, confidence, and relationships. For women, changes in sexual health can happen at any stage of life, after childbirth, during menopause, or simply as part of aging. Henceforth, female sexual dysfunction simply means difficulties that make sexual activity less enjoyable, uncomfortable, or even impossible. It is not a weakness. It is not in your head. It's a medical and emotional reality. What causes it? Now let's talk about what might be going on behind the scenes. Sometimes the cause is emotional or psychological. Things like stress from work, caregiving, or just life in general. Anxiety or depression. Body image issues, not feeling attractive or comfortable. past trauma or bad experiences, or even guilt or shame about sex, often rooted in early messages we heard growing up. All of these can make it harder for a woman to feel connected to her body or her partner. Other times, it's physical. Menopause, as estrogen drops, vaginal dryness or discomfort may increase. Certain medications like antidepressants or blood pressure pills, chronic conditions like diabetes, thyroid issues, or heart disease, hormonal changes after childbirth or during aging, even common things like lack of sleep or too much alcohol can affect desire. And then, there's the relationship itself. Is there emotional closeness? Are there communication issues? Are both partners feeling heard, loved, and desired? When the heart feels distant, the body often follows. Why it's different for women, this part is important. Women's sexual health is different from men's. Back in the 1990s, after Viagra was developed for men, scientists started looking for a Viagra for women, but it didn't quite work out. Why? Because women's sexuality isn't just about blood flow, it's about the brain, body, and heart, all working together. Trying to treat a woman's sex drive with one little pill doesn't capture that complexity. That's why many experts now agree. We shouldn't treat women like broken versions of men. We need better understanding, not quick fixes, when to seek help. So how do you know if something's wrong? Or just a part of life? Here's a simple rule of thumb. If it bothers you, if it hurts your relationship, or if you're feeling distressed, it's worth talking to someone. You deserve to feel good in your body. You deserve intimacy. And if something's getting in the way, there's no shame in asking for help. How to address it? Practical solutions. Now, let's get to the good news. There are many ways to address FSD, or lifestyle changes. A little exercise helps with mood and circulation. Mindfulness. And breathing exercises can help you stay present during intimacy. Limiting alcohol and getting enough sleep make a big difference. And don't underestimate the power of simply talking with your partner. Sometimes just scheduling quiet, private time together with no expectations can reopen that door. 2. Communication. Ask yourself, have I told my partner how I feel, what I need, what I'm afraid of? Open, honest communication can be hard, but it's healing. You don't have to solve everything at once, just start the conversation. 3. Medical. Help if you're dealing with pain, dryness, or hormone issues. Talk to your doctor. There are creams, lubricants, and medications that can help. For some women, hormone therapy may be useful. Others might benefit from adjusting medications they're already on. The good news? There are treatments and solutions. Doctors may recommend, such as hormone therapy for dryness or low estrogen, medications to improve desire or arousal, physical therapy for pelvic muscles, lubricants or moisturizers for comfort, and just as important, counseling, couples therapy, or support groups can help address emotional barriers. 4. Therapy. Sex therapy or counseling can help with deeper issues like past trauma, body image, or relationship strain. Even a few sessions with a trained therapist can be truly life-changing. Natural ways to improve sexual health. Alongside medical treatment, lifestyle choices can make a big difference. Stay physically active, exercise improves circulation and mood, eat a balanced diet, foods rich in omega-3s and antioxidants support blood flow. Manage stress with relaxation, meditation, or prayer. Prioritize sleep. A rested body responds better. Most importantly, keep open communication with your partner. Intimacy begins with trust. Emotional intimacy matters. Sex is not just physical, it's deeply emotional. Many couples find that affection, touch, and closeness outside the bedroom build confidence and comfort inside it. A kiss, holding hands, laughing together, these are powerful forms of intimacy. Busting myths. Let's bust a few myths. Myth. Losing interest in sex is just part of getting older. Truth. Desire can change, yes, but a satisfying sex life is still possible at any age. Myth. It's all in your head. Truth. Emotions and physical health both matter, neither should be ignored. Myth. If your partner has a problem, it means something's wrong with you. Truth. Sexual health is a shared journey. No one's to blame. Myth. Talking about sex is shameful. Truth. Talking is the first step toward healing. Silence only deepens the problem. Breaking the silence. My dear friends, if you or someone you know is struggling with sexual dysfunction, remember, you are not alone. Millions of women experience this, and there is no shame in seeking help. Talking to a trusted doctor, counselor, or even your partner is a step toward healing. You are not alone. Help is available. Never forget that. Sexual health is part of overall health. It deserves care, attention, and respect, just like your heart, your mind, and your body. Let's continue breaking the silence, supporting one another, and embracing every stage of life with dignity and joy. Thank you for joining me today. And remember, your health, your happiness, and your intimacy matter. You deserve closeness. You deserve joy, and you deserve to feel whole, body, heart, and mind. And it's never too late to reconnect with your body and your joy. Until next time, take care of yourself